Hello, everyone, and welcome to this emergency summit organised on behalf of 122 scientists from the UK and across the world. Today, we've published a letter in the Lancet outlining grave concerns about the UK government's plans to end all restrictions on the 19th of July, even as cases are rising here exponentially. Sajid Javid, the Minister for Health, has said that he expects that we will soon see 100,000 cases a day. The scientists and doctors gathered here today have come together at extremely short notice to produce this letter, in which they say the government is undertaking a dangerous and unethical experiment. We'll be hearing first from a few of the scientists and then taking questions from the press, and also asking a number of MPs who've joined us to respond to what they've heard. And we're also hoping to bring in some members of the public as well and some other groups.
Yeah, as you say, we've called this summit to express our concerns as both scientists and doctors about these plans to roll back almost all mandatory measures to control the spread of COVID-19 from the 19th of July, what's being called Freedom Day. Now, some of the things I'm most concerned about include the abolition of mandatory masking in public places, the abolition of physical distancing, the removal of crowd controls in places like pubs and cinemas and stadiums, and more generally, this encouragement to go about our lives as if the pandemic were over. And as Alice has said, it's not over. The UK currently has the fourth highest number of daily cases in the entire world. We are up there with Brazil, with India, with Indonesia. Yes, many people in the UK are now vaccinated. Yes, the link between infection and serious illness has been weakened, but no, that link has not been broken. There's currently hundreds of people in hospital, and some of those are vaccinated people. And let's remember that half the entire population of the UK, 1/3 of adults in the UK are not yet fully vaccinated. So these vaccination figures are going to rise. The campaign's still going on, so why the rush to open up before many of us are protected? Now, we need to factor in the mechanism by which COVID-19 spreads. There's now strong scientific evidence that this happens mainly through the air. Little tiny particles containing the virus get exhaled by one person and then they get inhaled by other people. And this happens mostly, as you'd expect, when people are in close contact. So when you're close enough to smell the garlic on someone's breath, that means you are breathing in air that has just been in their mouth and their nose. The more time people spend indoors, the more of these infectious particles are going to accumulate, and they will eventually spread throughout a whole room, infecting people even beyond 2 meters. Just a tiny word on masks. They're not 100% effective at stopping the virus, but if you're wearing a good, well-fitting mask, that will filter out between 60 and 90% of these viral particles. And that means that if you're wearing a mask and I'm wearing a mask, we're both doubly protected. So all this means that the best way to reduce the transmission of this virus is first, spend as little time as possible indoors sharing air with people. Second, if you must put people together indoors, keep them 2 meters apart. Thirdly, make sure that people indoors are wearing well-fitting masks. And fourthly, make sure those indoor spaces are well ventilated and that that the air is filtered. Now, let's just go back to Freedom Day before I hand back. The best way to increase transmission of COVID-19 would be to abolish physical distancing rules, to abandon the wearing of masks in indoor spaces such as offices, factories, school classrooms, cinemas, shops, public transport, and also to encourage people to gather indoors in underventilated spaces for prolonged periods of time. In other words, this new government policy seems designed to increase cases. Now, what I predict is going to happen is we are going to get hundreds of super spreader events caused by people gathering unmasked in indoor spaces. And we know that these super spreader events are the main driver of this pandemic. So let me hand back to the chair, and I hope I persuaded you that this isn't a very good policy.
As the World Health Organization's Director General, Dr. Tedros, said yesterday, worldwide coronavirus variants are currently winning the race against vaccines, and that threatens the global economic recovery. Dr. Tedros said that, of course, there's an appalling milestone of 4 million deaths was passed worldwide, and that even that exceptional number is an underestimate. It's far more likely to be more than double that figure. Across Europe right now, the Delta variant is surging in several nations, including here, of course, despite low seasonality and despite rising vaccination numbers. And globally, transmission is increasing in a large number of locations, again, also driven mostly by the Delta variant. These surges are taking place because of premature relaxation of mandates, or as Mike Ryan, head of emergencies at WHO, said yesterday, because of epidemiological stupidity. And the specific concern is that there is a considerable escape of the Delta variant from immunity derived from past infection and even from vaccination. Now, in the United Kingdom, currently, we are at around 128,000 deaths, although again, that's an underestimate. But the Institute of Health Metrics and Evaluation predicts that by October the 1st, there will be over an additional 10,000 deaths. In other words, we are at a very dangerous moment in this pandemic. So let's not be epidemiologically stupid. Our priorities should be first, scale up vaccination coverage, aiming for well above 70%. No country is yet at this level of double vaccination. Malta is 68%, Iceland 62%, even Israel at 57%. We are at 51%, with vaccination rates falling among the young. The NHS has done an absolutely incredible job in our vaccination program, but we need to do more, much more. Second, we need to continue, as Tony Fauci has recommended, mask use and physical distancing, even among those who have been vaccinated. If we don't do this, if we continue with the plan to lift mandates on July the 19th, it will not be freedom that we win. It will be a self-inflicted wound of uncontrolled transmission of the Delta variant that the Prime Minister refuses to even acknowledge, let alone accept. With more cases of infection, more hospitalizations, and more long COVID. And just pause for a moment to consider long COVID, please. It's important to remember that young people are more likely to become sick than to die from COVID-19. As many as 1 in 20 to 1 in 10 people have ongoing symptoms 3 months after a positive COVID test. And if we reach 100,000 infections per day, as Sajid Javid has predicted, that means 10,000 people each day with long COVID. The Office for National Statistics has already reported over 1 million people in April in the United Kingdom living with COVID-19, especially affecting those in the most socially and economically deprived parts of the country and among those with existing disabilities. So the key point is that the medium to long-term impact of COVID-19 is being seriously underestimated by counting only deaths. And of course, if we continue with July 19th, we will create enhanced conditions for the emergence of new variants, such as the Lambda variant that's currently a variant of interest. So to conclude, the overriding lesson from countries worldwide is that those who claim victory too easily will fail. And the government's plans currently defy all that we know about the science of coronavirus. It's as if the government believes that living with this virus means ignoring it or pretending that it does not exist. And only today we have heard warnings from the NHS Confederation and NHS providers about the current and future unsustainable pressures on the NHS. And so ministers will create substantial morbidity and mortality among families that have already endured the complacency of politicians if they continue with the plan that Boris Johnson set out earlier this week. It's a plan that is driven more by libertarian ideology than a prudent interpretation of the data. And so we were very pleased to publish this letter today. Thank you.
Friends, the government has still not learned lessons from its many mistakes, and it's not taking steps that are exposing our public so even greater risk than protecting them. We had more than 30,000 cases in UK yesterday. Our health minister has admitted it's very likely that we'll see 100,000 daily cases over the summer. Even if 1% of these go to hospital, that would mean 1,000 people admitted to hospital every day. This will mean horrific suffering for those affected, and we should take all possible steps to avoid as far as possible. But if we don't, how will we manage the demand this will place on the health service? What will we have to sacrifice to meet these needs who will lose out? Worryingly, we are seeing more and more younger people needing care. Our long COVID clinics are filling up with thousands of referrals, but prioritizing emergency care over the second wave has meant that many who have suffered the consequences of government failure to control the pandemic are waiting for care, even as our government once again pursues a policy that will produce hundreds of thousands of needing care. To conclude that, government has actively chosen to pursue a policy that will result in mass infection, huge levels of sickness and hospitalization again, especially when we are close to achieving sufficient vaccine coverage in a matter of weeks. This is completely unjustifiable and wrong. Government must act urgently to protect our public and our NHS.
In October last year, almost 7,000 scientists signed the John Snow Memorandum, which was a scientific consensus on what we knew about COVID at the time. In the John Snow memo, we laid out the dangers of pursuing a herd immunity strategy through natural infection. This was necessary at the time because this dangerous and unethical strategy was being actively promoted by influential advocates and interest groups who went on to advise governments, including our own, asking government to delay acting in September last year, which we know now led to tens of thousands of deaths. Everything we knew then still stands. And now that we have safe and effective vaccines against this virus, pursuing herd immunity through infection is all the more unjustifiable. At this point, our government has decided to abandon almost all mitigations. This is essentially letting the pandemic rip through the unvaccinated and is effectively herd immunity through infection. This will create a generation blighted by a disease from a virus they could have been vaccinated against in just a matter of the coming weeks. But the effects of this will be felt for years to come, and as usual, they will disproportionately be felt by the already disadvantaged. Just a few days ago, urged extreme caution on the removal of all COVID restrictions, even in countries with relatively high rates of vaccination. And when he was asked about the UK strategy, he stated that the logic of allowing more people to be infected has already been shown to be, in quotes, moral emptiness and epidemiological stupidity. This government strategy is callous and inhumane. How is a parent to protect their clinically vulnerable child who won't be offered a vaccine and is forced into crowded, unventilated classrooms without masks or distancing or bubbles? How does an unvaccinated or clinically vulnerable person who may not have sufficient immunity from vaccines going into work protect themselves when traveling on crowded buses and tubes where masks are no longer required? How can we accept this as a society, that our children and young are being actively exposed to an infection which causes long-term disease we don't even fully understand or know how to treat? Why should we doom a generation to the impacts of a novel virus when we can protect them and vaccinate them? And while countries like Israel, with much higher rates of full vaccination than us, are now taking urgent action to reintroduce masks and vaccinate children, but this latest step is far worse. It's effectively giving up on trying to control the pandemic at all when half of our population is not fully protected from vaccines. When half of our population is not fully protected from vaccines, we must not accept a policy of mass infection and mass suffering. And now the least the government could do is not lift all restrictions on the 19th. We could so easily hold out for a few weeks more till we've managed to vaccinate and protect many more people.
Has the virus kind of explored all its phenotypic options at this point, or could it still mutate to become even more dangerous?
I think it's extremely unlikely. And the reason why I say that is the virus is evolving constantly. And how we know that is because we have very, very good surveillance in the UK, and we're surveilling different sequences that are emerging right now. There's absolutely no evidence to suggest that this is the end of the line. There's so many combinations of mutations, and every 3 months or so, or even in less time periods, we've seen new variants emerge that are more transmissible, more severe, more likely to escape vaccines. And there's absolutely no reason to think that this will not happen again unless we prevent transmission, because that's the only way of preventing adaptation.
Are hospitals already struggling?
Yes, I'm afraid they absolutely are. So at the moment, and this is of course even before the mass relaxation that's planned for 10 days' time, we're as overstretched as we've ever been. A lot of A&E departments all over the country are reporting record-breaking attendances. So they are seeing more patients in a 24-hour period in A&E than they have ever recorded in their whole history. That's happening now. Yesterday, a very big teaching hospital in Leeds had to cancel some of their major cancer surgeries. Literally on the day of operation, these patients were told, we can't do your operations because there are no intensive care beds for you to go to post-operatively because they're filled with COVID patients. And this is absolutely awful. The bottom line is there's only a finite number of staff, and we are desperate to be addressing the terrible backlog of work that needs to be done. There are over 5 million patients waiting for surgery, for instance, now in the UK. But our ability to do that is fundamentally constrained by how much COVID is being transmitted through the country. Every patient with COVID being treated in an NHS hospital takes nurses and doctors and other healthcare professionals away from addressing the needs of all the non-COVID patients. So as far as we can tell, this policy of permitting up to 100,000 new cases of COVID a day is absolutely harmful to all patients, whether they are suffering from cancer, heart disease, a brain hemorrhage, a car crash, or COVID. And I think I'm speaking on behalf of patients when I say patients, by and large, are vulnerable members of society. They don't always have a lot of power or voice or status or clout, and they are not being heard. The vulnerable people are elderly, are immunosuppressed, all the clinically extremely vulnerable people who see so-called Freedom Day not as freedom, but as oppression, because it means they're terrified of being infected with a disease that could now kill them. And as a doctor who cares fundamentally about vulnerable patients, I find that abhorrent.
People are exhausted. Most of the mental illnesses now are affecting the doctors. Quite a few doctors who are off sick, they are off sick because of mental illness. So unless we really look into the workforce crisis,
I guess ask you about some of the comments from Chris Whitty from recent days. He mentioned, and I think this is built on some of the modeling from Imperial College, that opening up now in some ways might be better than opening up in the autumn, because it would just be sort of delaying deaths.
Sure. I mean, I was very puzzled by that comment too, because, it's common sense that obviously if you open up later, you can vaccinate more people, rather than allowing mass infection now. And I couldn't see how that would make the situation worse over winter if we open up later. But looking at all the models that the government seems to be relying on, the Imperial model actually did suggest that a delayed reopening might worsen possibly the number of deaths in over winter. But the reason for that is not the one that's been given by government. It's essentially because we've imported a variant that unfortunately has a level of escape against vaccines. And that means that the duration of immunity is likely to be lower, particularly the elderly, than it would have been before we imported this variant. The thing is that both of these can be prevented by, one, having a plan for booster doses for people by reducing transmission, putting in mitigation schools, and vaccinating children, which obviously wasn't part of this model. So I think it's created a sort of false framing and false dichotomy. Certainly waiting is better because we can vaccinate and protect more people.
July 19th, it seems, is universally accepted in this chat as a terrible idea. What sort of data would you like to see, whatever that may be, hospitalizations, vaccines, etc., for an unlocking to happen at some point?
Modelling exists for both the numbers of deaths that are projected for this summer and also the number of hospitalizations. And yet, when both Sajid Javid and Boris Johnson were asked for that modelling, they declined to provide it to the public. I don't want to do that in the dark. I want to see the modelling. I want to see the data. And at the moment, it seems as though not only is the political decision about the 19th of July being based on a date, not data, and certainly not on the science, it seems as though now the government is actively suppressing the science. They are not providing us with the modelling that would enable everybody to either feel comfortable or not with the planned loosening of restrictions for the 19th. So I want to see the government's modelling.
What I would want to see is a rise in vaccination rates to well over 70%, while still recommending the importance of mask wearing and physical distancing in certain situations, such as close contact, crowded spaces, and so on. Those 3 C's are really important. But the focus has to be vaccination rates. And my worry about July the 19th in relation to vaccination rates, and we're seeing this now, is that not unreasonably, many people who are not vaccinated are thinking, well, freedom is upon us. We don't have to worry anymore. And therefore, the pressure to get vaccinated is lifted. And that, I think, is contributing to the precipitate drop in the numbers of young people who are going to get vaccinated. And what we should be doing is not have July the 19th, accelerate vaccination, combat vaccine hesitancy, so we get those numbers up another 20 percentage points.
Yeah, I mean, we should have a look at Belgium, actually, because they've put in requirements for businesses to actually measure the levels of carbon dioxide in the building, which is a kind of proxy measure for the amount of air that's being shared, because we breathe out carbon dioxide. So I think that's a way that we should be going, is to look at ventilation. But I suppose the other thing I wanted to throw in is this idea of the mask as a symbol of loss of freedom, because actually I think we should be thinking of masking as a symbol of freedom. I think we should be thinking of masking as a symbol of freedom. If I'm wearing a mask and everyone else is wearing a mask, then I'd be prepared to get on a train. I'd be prepared to go to a meeting in the office. I'd be prepared to go into a supermarket. But if we're all unmasked, we're actually less free.
I wanted to pick up on this issue about the narrative of freedom, personal responsibility, individual choice. And we are completely reliant as a society on people who are working in transport, working in shops, working in health and social care, collecting our rubbish, everything. Those people are being put into situations that are already risky before July the 19th. And what we're saying to them, all these people rely on who don't have individual choice, who are having to work in unsafe settings, that they have to, as a result of other people's individual choice, have to put their own lives in danger. And my other real concern is that just by handing everything over to individuals and not taking responsibility for all the kind of mitigations that others have talked about, it will sow division. And again, in this country, unlike, for example, in the States, we've managed to avoid that to a large extent. But suddenly we're going to have one group of people, and actually the polls have shown it's probably the majority of people who are going to carry on wearing face coverings in indoor spaces, keeping distance where there's a risky situation, but a large section who are not. And this is potentially very divisive between people who think one group are being selfish and others thinking the other group are being neurotic, when we absolutely need to come together at this very dangerous point in time. So I think the whole narrative, as well as all the policies, needs to urgently change.
I really appreciate the way that your session this morning has challenged this idea of freedom, because one person's freedom day is another person's lack of freedom to be able to do some of the basic things because they haven't been vaccinated or because they are immunosuppressed. We don't allow people to drive down a motorway at 100 miles an hour because of risks to others. Why aren't we applying that same logic when it comes to COVID?
Thank you very much, Caroline. There does seem to be this focus on mortality and acute morbidity and not thinking about the longer term health effects. Trish Greenhalgh.
Yeah, my team's been doing research into the lived experience of long COVID. We've interviewed over 100 people who have symptoms beyond 12 weeks following an acute COVID infection. And I can confirm that this is a real disease. It causes real suffering. And one of the things it leads to, it affects every system in the body, but one of the things it leads to is what we call functional impairment. In other words, you can't do your job. With a lot of health professionals gone down with it because they were sort of in the front line to become infected. So doctors, nurses, porters, cleaners, people who work in the health service can't go back to work and do their jobs. There's a lot of them off sick. We are developing a generation of people with chronic disability through no fault of their own.
It has been described, and I think it is, as an experiment, a dangerous experiment. So I think it's really important that we challenge this narrative of so-called freedom, because of course it's not freedom if it puts other people at risk in the way it is. I think we need to carry on pushing for sick pay at real living wage levels, which is something I've been pushing for, because otherwise what we're going to get is a further intensification of a situation where those who are most likely to be exposed to coronavirus are also those least likely to be able to afford to self-isolate. And so we're really then going to see it becoming more and more a disease of the poor in this country and the vulnerable. It seems to me about the only thing that's been done well in this country has been the vaccine rollout, because the NHS has been and local health authorities have been in charge of that. And for all that good work to be put at risk by this reckless approach is completely indefensible in my view. And I think we need to understand, and I'll finish on this, that actually the public are with us on this sensible approach. The government tries to portray our view as somehow extreme or out of kilter. But I was looking at an opinion poll which showed the majority of the public not only believe that masks should be still in place in enclosed public spaces, but also that public health measures should continue. Public health measures should continue and not be completely removed.
To think that where the scientific arguments and the data are supporting what's being said, and where there are events like this, so that the conversation can be widened out and a very wide range of people can understand what the implications of what's being proposed are and what the alternatives are that are very doable, then I think there's a potential of a really important alliance coming together. And I think we should think that it is possible still, even with our new health secretary, to achieve a U-turn on this one.
Thanks, Alice. I'd like to be optimistic like Susan, but I'm less so. This word experiment that's been used is a very interesting word, because the word experiment starts off from assuming a position of uncertainty. You do something in order to make a discovery or test a hypothesis, but that's not what we're doing here. We know exactly what is going to happen by taking the course that the government has committed to. We know that there will be an increase in infections. That's not an experimental hypothesis to test. We know that hospitalizations are going up. We know that there will be an epidemic of long COVID, and we know that we're creating the risks for new variants. That is not in doubt. So what we have is a government that is pursuing an ideologically driven commitment to force the population to accept a level of mortality and disability in order to release us from the situation we're in currently. This has got nothing to do with data, nothing to do with experiments. This is ideology from the libertarian right.
The core reason why people need to isolate, children need to isolate, which is infection in schools. And it's very clear that many countries have done this and successfully kept schools open without having 650,000 children isolating. And we can do this too. And we need to do this regardless of vaccination for our long-term future for children.
Unless we improve the overall health of the population, unless we address inequalities and see those as part of pandemic preparedness, we will not be prepared for the future. But that is not to say that we do not also have personal responsibility. We should be wearing masks, for example, as Trish said, symbolic of our commitment to freedom, and also as symbolic of our commitment to one another, that I am responsible for your health just as you are responsible for my health.
We have measures in place in law to protect people from the dangers of passive smoking. So I don't understand what possible justification there can be for exposing our children to the virus in classrooms without mitigations in place, in workplaces, in leisure facilities, on public transport, and particularly in schools where they have no choice but to attend. The REACT-2 study indicates that between 30 and 40% of cases lead to long COVID of 12 weeks plus. So this is a huge issue, and I think we need recourse in law.
And we've been arguing for essentially stronger mitigations in classrooms, which would help contain some of this, which is masks, social distancing, reintroduction of bubbles, ventilation. And ventilation is not restrictions. I mean, we really need the media to stop thinking in terms of lockdowns versus opening up, restrictions versus no restrictions. We're not arguing for lockdowns here. What we are arguing for is preventing them, because how you get to a lockdown is not taking action with all the things that I mentioned early on. And that's where we're headed. You know, so this is not saying that we need to go into restrictions, but rather we need to prevent prolonged lockdowns by taking aggressive action early. And to be honest, it's already very late.